Just as Carol and Fred Kurpiel are beginning to come to terms with their daughter Ashley's amputation, Dr. William Schmidt has uncovered new evidence that suggests the amputation may have been completely unnecessary.
The more I reviewed my findings, I felt very saddened for the Kurpiels and Ashley.
Dr. Schmidt is confident that a strange calcification that's developed on Ashley's spine proves that she's suffering from an extremely rare and devastating disease. He takes a deep breath and picks up the phone to tell the Kurpiels exactly what he's found.
We were getting ready for our annual Memorial Day picnic, and I was in the kitchen getting things, and the phone rang. And it was Dr. Schmidt. And he sounded so sad to me, and I thought, what is this about?
I told her that after reviewing all the information I had obtained from evaluating Ashley, I felt that she had fibrodysplasia ossificans progressiva.
Fibrodysplasia ossificans progressiva, or FOP, is one of the most disabling genetic conditions known to medicine. In healthy individuals, a genetic signal instructs the body where and when to form bone. This begins as the skeleton is formed in the embryo. In patients with FOP, the mutation of a single gene alters these instructions, triggering sporadic and unnecessary bone growth, or ossification, in muscle mass throughout the body. In essence, the patient begins growing an extra skeleton.
As the patient progresses, on X-ray, one can see the development of bone in areas where there should be no bone, in unusual areas. In looking at Ashley's X-rays, the bone was developing more progressively and certainly becoming more definite for FOP.
I never heard of this $1 million word. I had to write it down to make sure I could even spell it correctly. I asked him to explain everything to me, what I needed to know.
To begin with, Ashley first exhibited signs of the debilitating disease when she was just 2 months old. What another doctor considered cluster toes was, in fact, the initial onset of the disease.
The patient with FOP, as a rule, definitely has shortening and abnormal development of the great toes in each foot.
And then, over time, the disease just took on a life of its own.
As the patient develops bone in the muscles, they will develop these areas of swelling that are tender. I think at the time that she had her first symptoms in the right shoulder, that was probably her first flare-up.
He goes on to explain that the latest swelling in Ashley's left shoulder is a clear indicator that the muscles in her remaining arm are beginning to transform into bone as well.
Eventually, her body would become very rigid, and basically, they become immobile. I couldn't believe I was hearing this. It was just so unbelievable.
As the Kurpiels struggle to come to terms with a devastating diagnosis, they can't help but wonder why no other doctor was able to put the pieces of the puzzle together.
On the biopsy, fibromatosis can look a lot like FOP. So it can be a very difficult pathological diagnosis to make because it was so rare. It just was not expected.
The Kurpiels' next step is to reach out to the world's leading expert on FOP, Dr. Fred Kaplan. And their first question is one they can hardly bear to ask.
I wanted to know, did the arm come off for no reason?
The amputation was done to save her life at that point because of the enormous amount of difficulty that was encountered. I don't think that the surgeons planned to do an amputation when they took Ashley into the operating room. Nevertheless, she came at it with an amputation and a catastrophic event that changed the rest of her life.
There was a misdiagnosis and there was a surgery that shouldn't have been done. And it was just absolute devastating information to get.
Unfortunately, almost 90% of FOP patients around the world are misdiagnosed. Not only misdiagnosed, but often have dangerous, painful, unnecessary procedures that actually worsen their condition.
In fact, research has proven that any sort of trauma or invasive procedure in an FOP patient can trigger catastrophic explosions of new bone growth.
Once the bone forms, it stays there. Sometimes spontaneously, but often after minor bruises and injuries, the FOP gets activated again. It's like a bear that's sleeping. Sometimes it sleeps, and sometimes it doesn't take much to wake this bear from hibernation, and that bear becomes very angry, attacks other skeletal muscle, and eventually replaces almost all of the body's skeletal muscles with extra bone. This is a complete metamorphosis.
Unfortunately, it is a metamorphosis that will continue for the rest of Ashley's life. There is no known cure or treatment for FOP.
At that time, there was very little known about this condition, and we had no other medications to administer these patients.
Without any way to stop the second skeleton from growing, Ashley's prognosis is grim.
The ultimate progression of the disease can lead to an early death. And the way that usually occurs is that chest expansion is limited and the patient has difficulty ventilating and expanding the lungs to get the adequate oxygen necessary.
I remember crying uncontrollably. I asked him how long he thought she had to live, and he said he thought it would be anywhere between 2 and 10 years because she was progressing so fast. I was numb. I could not move. I couldn't breathe. What was I to do? We were in this big world with no answers and a dying child.